Therapeutic ultrasound. Therapeutic ultrasound is one of the most misused modalities among clinicians. It is very important that you understand the theory, principles, and applications for the use of ultrasound as a modality. Ultrasound can be very effective if used properly. Therapeutic ultrasound is an inaudible acoustic vibration of high frequency that produces thermal and/or non-thermal physiological effects. Unlike other therapeutic agents, ultrasound is not part of the electromagnetic spectrum, but uses acoustical energy. Depending upon the frequency and the wavelength of the energy, ultrasound can be used for diagnostic purposes, therapeutic deep tissue heating, or tissue destruction. An example of a diagnostic ultrasound would be a fetal ultrasound or a sonogram. This type of ultrasound has a frequency of 0.5 to 50 milliwatts per centimeter squared. An example of a therapeutic deep tissue ultrasound would be what we see clinically. This type of ultrasound has a frequency of 1 to 3 watts per centimeter squared. An example of destructive ultrasound would be the use of ultrasound to break up kidney stones. This type of ultrasound has a frequency of 0.2 to 100 watts per centimeter squared. Ultrasound is a valuable modality for many different injuries, but primarily is used for the purpose of stimulating the repair of soft tissue injuries and relieving pain. Ultrasound's acoustical energy has an effect on both normal and damaged tissues, but may have a greater effect on the damaged tissues. The primary advantage of ultrasound over other non-acoustical heating modalities is that tissue high in collagen, as well as other deep tissues, may be selectively heated to a therapeutic range without causing significant tissue temperature increase in the skin or fat. High collagen tissues that respond well to ultrasound heat include tendons, muscles, ligaments, joint capsules, joint menisci, intermuscular interfaces, nerve roots, periosteum, and cortical bone. Remember that diagnostic ultrasound has a low intensity. Therapeutic ultrasound, which is the focus of this lecture, has a mid-range intensity, and destructive ultrasound has a high intensity. When comparing ultrasound to other superficial heat treatments, the ultrasound treatment is deeper. Warm whirlpools, paraffin baths, and silica gel hot packs all produce therapeutic heat, but their depth of penetration is superficial, at best only 1 to 2 centimeters. At 1 centimeter below the fat surface, a 4-minute warm whirlpool set at 105 degrees Fahrenheit raises the temperature approximately 2 degrees Fahrenheit. At the same depth, a 3 megahertz ultrasound can increase the same tissue to a temperature of over 10.8 degrees Fahrenheit. Therefore, if the purpose of the treatment is deep heat, an ultrasound would be a proper modality to choose. Ultrasound and ultrasonic waves. Animals such as bats, dolphins, and whales communicate with each other via sonar-like properties. Many of these transmissions are not heard by the human ear unless they are captured in a medium such as water. The animals make these sounds and listen for the sound to bounce off of objects to determine location and direction. The human ear is capable of detecting sound waves ranging from 16,000 to 20,000 hertz. Ultrasound has a frequency above this range, from 750,000 to 3.3 million hertz, or 0.75 to 3.3 megahertz. In the United States, the most common ultrasound frequencies are 1 and 3 megahertz. An ultrasound device is made up of 4 main parts: a generator, a crystal, a sound head, and an applicator. The largest part of an ultrasound device is the generator. It is the unit that produces the electrical energy. The electrical generator produces an alternating current via a high-frequency electrical generator linked through an oscillator circuit and a transformer. The oscillator circuit produces a specific frequency electrical current at the frequency requirements of the crystal. A coaxial cable connects the generator to the crystal, which is housed in an insulated applicator handle. The generator houses a control panel with buttons or switches that regulates the following parameters: on-off, power, time, intensity, duty cycle, continuous or pulsed modes, 1, sometimes 2 or 3 MHz frequency, and an automatic shutoff in case the crystal overheats. The applicator is the structure that you hold onto to apply the ultrasound, and the crystal is located inside of the ultrasound transducer, known as the ultrasound head. The sound head transfers the acoustical energy or sound waves from the crystal to the tissue, where it causes the tissue to vibrate. The sound head is commonly a ceramic, aluminum, or stainless steel plate that is attached to the crystal. The crystal is a thin, synthetic ceramic that is usually made of lead, zirconite, or titanate. The crystal produces a positive and negative charge when it contracts and expands. The crystal is a transducer that converts electrical energy to acoustical energy through mechanical deformation of the crystal. When an alternating electrical current is passed through the crystal, it expands and contracts, creating what is called the piezoelectrical effect. There are two forms of the piezoelectrical effect. The direct piezoelectrical effect is the creation of an electrical voltage across the crystal as it is compressed or expanded. The reverse piezoelectrical effect is the effect created from an alternating current running through a crystal, resulting in a compression and expansion of the crystal. Ultrasound is produced by an alternating current flowing through a piezoelectric crystal housed in the transducer. The reverse piezoelectric effect is also known as just the electrical piezo effect and is created from an alternating current running through a crystal, resulting in a compression and expansion of that crystal. In the first picture, highlighted in red, with no current flow, the crystal is normal shaped. In the second picture, highlighted in blue, current flows in one direction and causes the crystal to become concave. In the third picture, highlighted in green, current flowing in the other direction causes the crystal to become convex. The expansion and contraction of the crystal creates a vibration at the frequency of the electrical oscillation received from the generator. The vibration of the crystal causes the sound head to vibrate and results in the mechanical production of the high-frequency sound waves. Ultrasound transmission occurs to tissues in the human body. Acoustical energy is transferred by one molecule colliding with another, and in the process exchanging kinetic energy without actually displacing the molecules. Consider a leaf floating in water. If a pebble is dropped near the leaf will bob up and down as the water ripples past beneath, but does not disrupt the leaf. We see a similar phenomenon occurring with ultrasound application to tissues. When ultrasound is applied, acoustical energy causes the molecules to vibrate and bounce into each other and affect the next molecule, and so on. The acoustical waves are transmitted to the tissue either as longitudinal or transverse waves, depending upon the tissue that the ultrasound is targeting. Will result in either longitudinal or transverse waves that occur in the body. Longitudinal waves occur parallel to the direction of the sound wave. The alteration of high and low pressure generated by the ultrasound beam results in regions of high particle density or compression and low particle density, rare refraction, along the path of the wave. These pressure fluctuations transmit the energy within the tissue and produces physiological effects of ultrasound. Ultrasound passes through soft tissue as a longitudinal wave. Molecules in transverse waves are displaced perpendicular to the direction of the energy. When the longitudinal wave of the ultrasonic beam strikes a bone, for example, it transforms into a transverse wave. Within a longitudinal wave pathway, there are regions of compression and rare refractions. Compressions are areas of high molecular density and high pressure as the molecules are squeezed together. Rare refractions are areas of lower molecular density as the molecules are pulled apart. The law of Grotthus-Draper states that there is an inverse relationship between the penetration and absorption of energy, by which any energy that penetrates the body and is not absorbed by one tissue layer is passed along to the next layer. The more energy that is absorbed by the superficial tissue, the less remains to be transmitted to underlying tissues. Energy must be absorbed by the target tissue to be effective. The effect of treatment are only seen at the point of absorption. Any energy that gets absorbed by superficial tissues may not have a chance to affect deeper tissues. Energy prefers to travel in a straight line. As energy enters a medium of different density, the energy may slightly change its course based on changes in density. Energy striking the interference between two different densities may be reflected, refracted, or absorbed. If the energy is not absorbed, it becomes attenuated, which means that there is a decrease in energy. Reflection occurs when the wave cannot pass through the next density. The wave strikes the tissue and reverses its direction away. Refraction is the bending of a wave as it results in a change of the speed of the wave as it enters a medium of different density. When the energy leaves a density layer and enters a less dense layer, its speed increases. Absorption occurs when the tissue collects the wave's energy and change that energy into kinetic energy and then possibly into heat. The tissues may absorb part or all of the energy being delivered to the tissues. Any energy that is not reflected or absorbed by one of the tissue layers continues to pass through the next tissue until it strikes another density layer. At this point, it may again be reflected, refracted, absorbed, or passed on to the next layer. Each time, the wave is partially reflected, refracted, or absorbed, reducing the amount of energy available to deeper tissues. The Arndt-Shultz Principle states that in order for energy to affect the body, it must be absorbed by the tissues at a level sufficient to stimulate a physiological response. If the amount of energy absorbed is too small, then no significant reaction will take place. If the amount of energy is too great, then damage results. The goal of the treatment is to find the optimal treatment parameters for a modality in order for normal functioning to take place and to facilitate optimal environments for healing. The Arndt-Shultz Principle reminds me of a classic story of Goldilocks and the Three Bears. Goldilocks sits in their chairs, eats some of their porridge, and falls asleep in one of their beds. The entire time she is trying the bears' things out, she is looking for the right fit. We're doing the same thing with ultrasound and modalities in general. We're looking for the right parameters and the right fit for our patient. Remember, more is not necessarily better, especially with ultrasound. Sometimes more can be destructive, and we can do a lot of damage to tissues. Ultrasound heads are available in different sizes and with different crystal resonating frequencies. A resonating frequency is essentially the vibration frequency available in the ultrasound head. The effective radiating area is also known as the ERA. It is the proportion of the transducer surface area that produces ultrasonic energy. The effective radiating area, or ERA, is described in terms of square meters. The ERA is determined by scanning the crystal at a distance of 5 centimeters from the radiating surface and recording all areas that produce more than 5% of the acoustical energy of the maximum power output on the surface of the ultrasound. The ERA is always highest in the center of the crystal and is less in the periphery. The ERA is always smaller than the actual size of the transducer's face and may differ from the value listed on the unit. No crystal is 100% active. A large ERA produces a collimated or more focused beam. Smaller ERAs have a more divergent beam. When treating a localized area, use a collimate beam if you have one available. When treating a larger area, such as a muscle strain, a divergent beam is more indicated. Here's an example of how to calculate the ERA. We start with a sound head. The ERA is whatever part of that head is active during the treatment. Remember, the sound head is most active in the center and becomes less active towards the periphery. The ERA is used to determine the size of the treatment area for the patient. We should only treat an area that is 2 to 3 times the ERA. Once we know an ERA, then we can start to determine the size of the treatment area. Remember that the effective radiating area may be significantly smaller than the actual size of the ultrasound head, so you must read the manufacturer's guidelines to determine the ERA. We can treat this area that is 2 to 3 times the size of the ERA. In this example, we will use a treatment area that is 3 times the ERA. The ultrasound treatment can occur within this small area. While the size of the ultrasound head is important, the ERA is the most important aspect in determining the size of the treatment area. Just because an ultrasound head is larger does not necessarily mean that an ERA is also larger. It depends on the quality of the crystal and the manufacturing process. Ultrasound output frequency is measured by megahertz and describes the number of waves produced in 1 second. Most commercial ultrasounds offer 1 or 3 megahertz options. Occasionally, they offer a 2 megahertz option as well. The output frequency determines the effective depth of penetration. Low frequency, or 1 megahertz ultrasound, is utilized to treat deeper tissues. A 1 megahertz output targets tissues up to 5 or 6 centimeters deep. 1 megahertz has a beam that diverges more than high frequency, or 3 megahertz ultrasound. The amount of attenuation depends on what tissue the ultrasound waves come into contact with. Remember that attenuation is a decrease in the amount of sound waves transmitted due to increased absorption. We see less attenuation during 1 megahertz ultrasound treatments. High-frequency ultrasound is used to treat more superficial treatments. 3 megahertz has a penetration depth of at least 2 to 3 centimeters. 3 megahertz has a beam that is more concentrated and is more intense. There is more attenuation with 3 megahertz treatments. 3 megahertz ultrasound energy is rapidly absorbed and heats 3 times faster than 1 megahertz ultrasound treatments. The heat produced from 1 megahertz lasts longer than 3 megahertz. The power or energy produced by an ultrasound generator is measured in watts, which is abbreviated by the letter W. The intensity describes the strength of the sound waves at a given location within the target tissues being treated. The power and the intensity do not affect the depth of penetration. The spatial average intensity, or SAI, describes the amount of energy passing through the sound head's effective radiating area, or energy density. The spatial average intensity is a measure of the power per unit of area of the sound head. The SAI is calculated by dividing the power of the output, measured in watts, by the ERA of the transducer head, measured in square centimeters. In the example given on this slide, the spatial average intensity can be calculated by taking a 7-watt power output and dividing it by a given effective radiating area, which is given at 5.0 centimeters squared. In calculating the math, the spatial average intensity is 1.4 watts per centimeter squared. Therapeutic ultrasound generators are limited to a maximum output of 3.0 watts per centimeter squared. The half-layer value is the depth where 50% of the ultrasound energy has been absorbed by the tissues. If ultrasound is applied at 1 watt per centimeter squared and loses 50% of its energy at a depth of 2.3 centimeters, the beam intensity is now at 0.5 watts per centimeter squared. At twice this depth, which would be 4.6 centimeters, the ultrasound intensity is reduced to 0.25 watts per centimeter squared. The effect of the half-layer value and the penetrating effects of 1 and 3 megahertz, which has a half-layer of 0.8 centimeters, output frequencies are used to target tissues during treatment. The quality of the crystal greatly affects the half-layer value. This table represents the half-valve thickness for different types of body tissue. The tissue with higher water content allows energy to pass through easily. Fat has very little absorption and energy easily passes through. Skin has slightly more absorption, and the resistance is greatly affected by the hydration level of the patient. Muscle tissue easily absorbs energy, as do tendons or other high protein or collagen content. Although not shown on this graph, peripheral nerves allow energy to be absorbed at twice the rate of muscle. And finally, superficial bone, the energy is absorbed more efficiently than any other tissue. Nearly all therapeutic ultrasound devices can produce either a continuous or a pulsed ultrasound, which can also be called the mode of the treatment. With pulsed ultrasound, the energy is periodically interrupted with no ultrasound energy being produced during the off period. Pulsed ultrasound reduces the average intensity of the output over time. The percentage of time that ultrasound is generated, also known as the pulse duration, over one pulse period is referred to as the duty cycle. The duty cycle is calculated by taking the pulse duration, or the on time, and multiplying that number by 100. You would then take that number and divide it by the pulse period, which is the amount of on time added to the amount of off time. Common duty cycles for non-thermal ultrasound are 10%, 20%, or 50%. With continuous ultrasound, the amount of sound energy remains consistent throughout the treatment. That is, the ultrasound energy is produced 100% of the time. The amount of heat produced in both continuous and pulsed ultrasound can be seen in the pictures. In continuous ultrasound, the unit is on 100% of the time, and therefore is constantly producing heat in the treated time. In the pulsed ultrasound, the unit switches back and forth between periods of on and off. During the on time, the ultrasound is producing heat. During the off time, the ultrasound is off and allows the tissue to cool. Again, the comparison between pulsed and continuous ultrasound is important to understand. In continuous ultrasound, the intensity remains constant over time. The machine is 100% active, and therefore we receive thermal effects of ultrasound, which is great for treating chronic injuries. During pulsed ultrasound, the intensity is interrupted, and therefore the average intensity over time is low. The total amount of on time may be 10% or 20%, which will result in a non-thermal, or maybe more accurately, a minimally thermal treatment. These non-thermal treatments may be used with acute injuries. A greater duty cycle of approximately 50% will result in slight heating effects, which might be appropriate for subacute injuries. The treatment duration is one of the most complicated things to figure out for a clinician. The treatment duration depends on multiple factors, including the size of an area, the target tissues or depth of treatment, and the desired effect of the treatment. In many clinical practices, general treatment time durations are between 5 and 10 minutes. There are multiple factors for this standard treatment time for ultrasound. In many therapeutic clinics, this is the treatment time that is billable to insurance and patients. And for many athletic trainers, especially with high capacity or high volume teams, it can be difficult to spend more than 5 to 10 minutes with any one single athlete. The factors that have been discussed really are important to determine the proper amount of treatment time for a treatment. This is one of the major issues with ultrasound. Many clinicians do not dedicate the proper amount of time to treatments to reap the desired effect, and therefore the treatment is largely ineffective. The beam non-uniformity ratio, or BNR, indicates the amount of variability within the intensity of the ultrasound beam. The ultrasound beams are not completely uniform. They have small peaks and valleys on them. These peaks and valleys of high and low energy are shaped by minute imperfections in the crystal, producing the sound waves. The BNR is the ratio of the spatial peak average intensity across the beam, both of which are measured with an underwater microphone. The beam non-uniformity ratio is calculated by dividing the spatial peak intensity and dividing it by the spatial average intensity. The BNR is often profiled as a topographical map, many times with heat intensities. A perfectly uniform ultrasound beam would have a BNR of 1:1. This would be a beam that has no peaks and no valleys. The mass manufacturing process makes producing crystals of this quality impractical. A good BNR would be a ratio of 3:1 or even 4:1. If the BNR is indicated as 3:1 and the meter displays an output of 2 watts, then at some point in the beam, the actual intensity is equivalent to 6 watts. If we multiply 3 times the 2 watts, we get the total of 6 watts as the maximum peak. The presence of high-intensity areas in the beam results in hot spots. We must keep the ultrasound head moving to prevent these hot spots from creating tissue damage. A BNR with a ratio of 6:1 would be considered unsafe, and any BNR that is 8:1 is dangerous. Lower ratios are safer and more desirable. The BNR of individual crystals is not required by the Food and Drug Administration Center for Devices and Radiological Health. The BNR is required to be reported on the ultrasound unit. However, the FDA allows companies to randomly sample their transducers and report the maximum BNR found. The BNR of the sound head being used may be different than what is indicated on the unit label. Both thermal and non-thermal ultrasound produce physiological effects. The primary purpose of thermal ultrasound is to increase tissue temperature. The clinical effects of thermal ultrasound include, but are not limited to, increased extensibility of collagen fibers in tendons and joint capsules, reduced viscosity of fluid elements in the tissues, decreased joint stiffness, reduced muscle spasm, diminished pain perception, increased metabolism, and increased blood flow. Regardless of whether or not thermal effects are produced with ultrasound, non-thermal changes do occur. The non-thermal effects of therapeutic ultrasound in treatment of injured tissues may be as important, if not more important, than the thermal effects. These effects include increased histamine release, calcium ion influx, increased phagocytic activity of macrophages, increased protein synthesis, increased capillary density of ischemic tissue, tissue regeneration, wound healing, cell membrane alteration, attraction of immune cells to the injured area, increased fibroblasts, and vascular regeneration. The thermal and non-thermal effects are not independent of each other. Rather, they both occur in some capacity, but with different settings, more thermal or non-thermal effects may be seen. Again, the non-thermal effects of ultrasound include early resolution of inflammation, enhanced fibroblast recruitment, fibrinolysis, angiogenesis, phagocytosis, protein synthesis, collagen synthesis, which helps facilitating with tendon healing, and collagen synthesis, which helps to facilitate tendon healing, increased tensile strength, which also helps to facilitate tendon healing, increased matrix synthesis, accelerated fracture healing, and increases in cellular and vascular permeability. These non-thermal physiological effects occur as a result of microstreaming and cavitation. Microstreaming occurs when eddies form. The ultrasonic energy causes the acoustical streaming or microstreaming. Acoustical streaming is the bulk of fluid flow in one direction. When the acoustical stream courses around gas bubbles, the cell membranes, and its organelles, then eddies form. The eddy currents over the cellular membranes cause the release of free-floating ions and small molecules, increasing the cell membrane permeability that alters the diffusion rate across the cell membrane. This change allows sodium and calcium to diffuse for healing. Cavitation occurs as the result of pressure changes created by the ultrasonic wave that deforms microscopic tissues. The ultrasonic peaks and troughs become accumulation of gas and the formation of microscopic bubbles. These bubbles then pulsate in the ultrasonic field. Cavitation can either be stable or unstable. During stable cavitation, bubbles compress during high-pressure peaks and expand during low-pressure troughs, which create a desired effect. If the cavitation becomes unstable, then there is a collapse of the bubble during the low pressure point. This creates an undesired effect. In order to reduce the effect of unstable cavitation, we must keep the ultrasound head moving. Unstable cavitation results in damaged cells and leaves a wake of debris from the treatment. Unstable cavitation can also be caused by a high BNR, such as one that is higher than an 8:1 ratio. The primary purpose of thermal ultrasound is to increase tissue temperature. The clinical effects of thermal ultrasound include, but are not limited to, increased tissue extensibility of the collagen fibers in tendons and joint capsules, reduced viscosity of fluid elements in the tissues, decreased joint stiffness, reduced muscle spasms, diminished pain perception, increased metabolism, and increased blood flow. The biggest difference between ultrasound and the superficial heating modalities is the depth of tissue available to treat. It is most common to use ultrasound to increase tissue elasticity. Ultrasound is great for effectively heating collagen-rich tissues, including tendons, ligaments, fascia, and scar tissue. Once the ultrasound treatment has been completed, You have a 3-minute stretching window to either stretch or perform joint mobilizations before the tissue begins to cool. Repeated applications are often necessary to regain range of motion and to increase tissue elasticity. The indications for the use of therapeutic ultrasound are fairly broad. The indications for the use of thermal effects of ultrasound include chronic inflammation, chronic pain, joint contractures, muscle spasm, neuroma, scar tissue, SNS disorders, trigger points, warts, and spasticity. Myositis ossificans, which is when someone sustains repetitive trauma to a muscle and a bruise forms. The trauma then continues, and there becomes a calcium deposit growing within the muscle. Another name for myositis ossificans is heterotopic ossification. The indications for non-thermal ultrasound include acute, subacute, and chronic inflammation and wound healing. The general indications and contraindications for thermotherapy still apply to ultrasound. The contraindications for the use of ultrasound include acute injuries, especially for thermal treatments, impaired circulation or sensation, blood clots such as DVTs, thrombophlebitis, or other conditions, cancerous tumors or infection, exposed metal implants, replace joints using plastic or fixated bone cement, or to breast implants for using ultrasound at higher doses, around the eyes, heart, skull, carotid sinus, and even genitals, over a pacemaker, over the pelvic area for someone who is either pregnant or menstruating, or over fracture, stress fracture, or osteoporosis sites. You will most likely know the patient's reaction immediately when applying the ultrasound treatment if there is a fracture. The acoustical microstreaming and cavitation will result in an oscillation, which will move the bone fragments and will result in a substantial amount of pain. The precautions for the use of ultrasound include the spinal cord or large nerve plexuses, such as the brachial plexus. We would not want to use very high dosage. And if we are going to perform ultrasound, we need to do it with extreme caution. We need to be cautious for myositis ossificans or heterotopic ossification. With the wrong parameters or a high-dose treatment, such as thermal treatment, we may result in unwanted growth of that area. We also need to be very cautious in treating adolescents, as ultrasound may affect the epiphyseal plate and could cause premature growth plate closure. Internal metal implants are not a contraindication as long as the sound head is kept moving. Low-intensity pulsed ultrasound, which is sometimes abbreviated LIPUS, has been demonstrated to increase healing rates for acute and non-union fractures. So this begs the question, do you think this could be a good treatment for stress fracture? Stress fractures are a common injury in runners and many athletes, so we may be able to use ultrasound to facilitate an optimal environment for bone healing with certain ultrasound parameters. Treatments have been suggested to be approximately 20 minutes per day with this low-intensity pulsed ultrasound, and the research is looking promising.